Hi, my name is Caroline Figueroa. I'm a postdoctoral researcher at the University of California, Berkeley, and I was also trained as a medical doctor at the University of Amsterdam. So today I'll be sharing with you some lessons learned from our study about video calling with patients who have limited digital literacy skills. So just to give you some background, I'm involved in a study at the University of California, San Francisco, in which we're testing a smartphone app that helps people become more physically active. And it's for people who have diabetes and depression. And we're testing patients who are served in a safety net setting, which means that they're in a public sector hospital and that they are people who cannot afford private health insurance, meaning that they are low income patients. So we started our study, a randomized clinical trial to test this app when COVID happened. And we were normally doing interviews face to face with these patients, but because of COVID, we couldn't do that anymore. So we had to come up with a swift protocol for testing our patients, doing these interviews in a remote manner. So what we did is we designed a protocol for testing digital literacy skills during our screening phone call. So what usually happens in the study is that patients are referred to us by clinicians. We give patients a call, we assess their eligibility for the study, and then we set up an appointment to do an interview. So now we implemented a extra portion of our screening phone call, and that consisted of the following two steps. So the first thing that we did was we assessed patients' digital literacy skills. And we assessed this by asking them about 3 different points. So the first was digital access. Do they have a laptop or a smartphone that can access the internet? The second was digital literacy. Do they know what a smartphone is? Do they know what an email is? Do they know what an app is? And the third one was digital skills. Do they know how to use a smartphone? Do they know how to text? Do they know how to open links on their phone or their computer? Do they know how to download an app? And then when we assess all of these 3 points, we divided the patients into 2 different groups. The first was having limited digital literacy skills, and the second was having satisfactory digital literacy skills. And then the interview portion was based on whether the patients fit into these 2 groups, so our approach to the interview. So if people had limited digital literacy skills, we would spend an extra phone call on helping these participants download the video calling software and use the video calling software. So this usually meant about 10 minutes of guiding patients through this process, which also meant that our staff had to be trained to help participants go through this process. Now, if participants had satisfactory digital skills, this extra phone call wasn't necessary. And if they didn't have any access to the internet, or if the coaching wasn't working, then we had to, instead of doing video calling, we had to just do the entire interview over the phone. So what we found was, and we tested about 20 participants using this new protocol, and we found that this worked really well. And 10 of these participants, so about half of them, had limited digital literacy skills. And for them, with this extra guidance, they were able to engage in the video calling. So the lessons learned from this are really that patients with limited digital literacy skills are interested in video calling, but they need that extra guidance. And then the staff needs to be trained to provide that guidance. So what this means is that the health systems and the providers need to invest more resources, more time, and commitment to video calling with patients who have limited digital literacy skills. Now, I'd be happy to share some more details of our protocol and give you some more information And please do not hesitate to contact me. Thank you.